I'm a micro-preemie mom to twins. I had the best case scenario with my daughter and the worst case scenario with my son. Pretty much all of the 24-weekers have to have their PDA closed either with medication or with surgery. For my daughter, hers did close with medication, but it opened back up when she got an infection, so we did have to be transferred to get the Piccolo procedure done to close her PDA. It worked wonderfully and was life-changing for her. Some of them do close on their own, but a lot of times they do need help with the medication or surgery. About 50% of 24-weekers do have developmental delays, but they oftentimes catch up between ages 2 and 5. Many 24-weekers grow up to walk, talk, eat, breathe, do all things on their own, and are completely normal children, which is mind-blowing to me. And that is the case with my daughter. Feeding issues are very common due to oral and airway trauma early in life. A lot of these babies aspirate, so they go home on a G-tube, or they have a G-tube into early childhood, but a lot of them get rid of it. We were very fortunate in that my daughter never needed a G-tube, but she did have an NG and an OG while we were in the NICU. Early interventions such as PT, OT, speech therapy, all of these things are key to helping these babies thrive, and many of them do thrive with early intervention. 1 in 3 micro-preemie parents do have PTSD, and I would say I absolutely have PTSD from it, not only from having micro-preemies, but also from losing my son and the birth and everything that came after the NICU, and honestly from some of the people and the healthcare workers that were in the NICU with us. Some of them were absolutely amazing, and some of them were some of the most unkind people that I've ever met in my entire life. There's just some crazy stuff that happened there that I have told to some personal people in my life, but I've never spoken about it online, and I don't know if I ever will. If I told you guys, you would be shocked. Rates of postpartum anxiety and depression are about 2 to 3 times higher, which duh, that makes sense, right? And then family stress is huge when you have children in the NICU, especially if they have older siblings that are at home. Us, we were in the NICU for 101 days, and I didn't have any children at home, which was lucky because we were in the Ronald McDonald House for 101 days, and I just couldn't imagine what it would be like to have to split my time between my babies in the NICU and my babies at home. I strongly believe that all women should be educated on the signs and symptoms of preterm labor and that it should be taken seriously. I went to the ER and told them that I was in labor and was actually turned away before I gave birth. It's literally crazy. A healthcare professional, a doctor, turned me away and told me that I was not in labor, and then I delivered at 24 weeks. Micro-preemies and their parents are warriors, and they are fighters, and they are so incredibly strong.